Hello everyone, my name is Maria Mendez and today I'm going to give you a little tour in the salon, but also we're going to talk about self-care. Well, we're going to start right here as giving you a little tour, and we're going to talk a little bit about what we offer in the salon. And this is our area where we have our wigs and a little bit of hair products. And what we do in the other section, right in this area, we do wig consultations. Once we're here in our wig room, what I typically do with our patients is we have them sit down, and one of the most important things that we have as an offer in our salon is wig measurement. So what we do is we measure, the longevity from the front to the back of their head, and then from the side panels to the side panels, and then the circumference. Is essential that we measure that and that they have this information, and then once they have that information, they can make a decision whether they purchase from us or they go with anybody else out there. But it's important that they also get a little bit of trial. Well, welcome back. We're now in the manicure area station. Take a look around. Take a look at the place that you are going to be sitting in front of it. Make sure that it's clean, that it's appealing for you to sit down, and also that you feel comfortable talking about the needs that you have. Safety is so important, especially like I repeat myself, when you're going through chemo, your nails change, your sensitivity change, your nails color change. Number one thing that you always want to start with is make sure that you have a good clipper that is strong and steady, that it's professional. It's gonna have a long lasting. Also, if you have to use a nipper, make sure that that is also stainless steel that you can sanitize, as well as a cuticle pusher. And then you also have a buffer. A buffer is to serve to buff the top of the nails, and a crystal file. Why do I choose a crystal file versus a metal or a emery board? It's because the crystal file is a lot softer in your nails. And when you're going to treatment, those nails become very sensitive. Not only that, but also this, you can wash it with soap and water and sanitize it with alcohol, and you'll be ready to go for the next use. Make sure that you have a good lining, that you can see what you're doing. And again, if you have somebody else doing it for you, which is even better. I think this is where it comes to the human touch, the ability to have and serve somebody else's when you getting your nails done. This is Maria. We're gonna now talk a little bit about foot care. Foot care is so essential. It's one of the number one services that I personally enjoy doing. Plus, I feel like we need and have to be a little bit more mindful about doing it, because we have two set of feet that carry us everywhere we go, and so we need to care for our feet. It's very important. As far as the three things that are important is make sure that it's clean, that things are comfortable, that you feel comfortable explaining and back and forth. There's a good feeling about it. The tools you need is again, another clipper that is steady and strong, that you can sanitize, wash with soap and water, and then you can sanitize with alcohol. The cuticle pusher, it's so important that you have two different. This type of cuticle pusher has a flat surface and it has like an arrow surface. The flat surface is to pull and to push the cuticle around it, and then this surface, it's the one that you remove any debris that is stuck in between the nails and the toenails. Then we also have the clipper again, the nipper, excuse me, where you're going to use is basically to remove any extra skin. Now, if you have high blood pressure or diabetes, this tool would be probably one of the tools that you might not have to use at all, and you shouldn't be using unless is necessary, but I recommend that you do not, because obviously if there's a cut and it could be a little bit unsafe. So be comfortable sharing that information. You also gonna need a buffer at home, or they're gonna use that at the salon. And this time you do want to use an individual file that is only going to be used on you, but you want to make sure that everything is clean. You want to make sure that they use the correct file for the toenails. Again, let's take a little moment to talk a little bit about toenails while you're going through chemo. Toenails when you're going through chemo changes. A lot of times the discoloration changes. A lot of times you have no sensitivity. A lot of times there's tenderness. So you might not be comfortable utilizing some of these tools. Or your skin under the sole, it could be a little bit of rough as well. So always be mindful to express what feels comfortable and what does not feel comfortable. The second thing that I want to talk, and if you're doing this at home and the person that is doing your pedicures, or you find yourself doing your pedicure at home, make sure that you get things ready, okay? You want to have everything set on a little table, where you have a close reach to it and you feel comfortable. Make sure that you have a good light to see where you're cutting. Make sure that they are sitting in a position that they feel comfortable. You love them so much, you don't want them to hurt their back or strain your shoulders or your back. It's me. Now we're gonna talk a little bit about hair and scalp. Our hair, when we are going through chemo, changes. Obviously many of you probably have experienced hair loss due to the chemo, and also a lot of changes in the skin within the scalp. And that's what we're gonna concentrate today. We're gonna talk about the misconceptions and the things that sometimes frighten us once we know that we are about to lose our hair. I tell them personally, do not be afraid. But again, our hair has a mechanism, a natural cycle that it restores back. It is important to feel comfortable with the decisions you're making. It's more importantly that you have the support of those around you to gather around you and empower you, because that is a very crucial moment for females and males. You can make this a little party together, where everybody takes turns and decides to take off and shave your head. That's absolutely acceptable. It's what feels comfortable, and what makes you feel comfortable to you might not be the same comfortness for someone else. But very important that we companion each other in this journey. Now you might question yourself, now I don't have hair, now what I'm going to do? Am I not going to wash my hair? Am I going to wash my hair? I tell my patients that they still have to wash their hair, and whether it was a daily basis that they used to do it, they still want to do it. They still should do it, because it's important to keep a healthy scalp. Healthy scalp is going to bring hair back. Once you made the decision about cutting your hair, you're about to get your head shaved, what are the things that I recommend to our patients to care for their scalp while home? Or you do want to continue washing your hair as regular as were used to it. I do not want to see anybody stopping washing their hair, because that is the most misconception thing to do. Your head and your hair has a natural cycle, that once your natural cycle stops, and it will find itself back in, and it's going to restore the follicles inside. But what do you do at home to do that? Well, we're gonna utilize brushes. We're gonna utilize loofahs, but number one thing, you do want to brush your hair daily. You might find yourself, what am I going to brush? You're still going to brush your scalp. Brushing your scalp is so essential, because it activates our follicles. It activates the circulation of the bloodstream, and that helps the hair to grow. Type of brush that I would recommend to use when you're brushing your scalp. You can also select like a baby brush. It has to be a bristle brush, natural bristle brush that you can actually create friction, because that's exactly what you're gonna create, friction against your scalp. That is gonna activate all your circulation and all your blood vessels in the scalp. So once you finish brushing and scrubbing your scalp before you shower, you want to make sure that you feel comfortable doing that with your brush. And after that, obviously, you take a shower or you wet your head, or if you don't want to completely take a shower and wash your head, you can always use a towel and just wet it, and make sure that the water that you use is comfortable in your scalp, that is not overly hot or overly cold. It has to feel comfortable. Use a towel and just kind of like undust your scalp, because believe it or not, there's a lot of dust from our skin that gets stuck in there, and you will see it right in there, because naturally sometimes when you're going to treatment, your scalp becomes very dry and or oily, or it can break out as well. So just be mindful. Always take a look at your scalp. Have someone to take a look at your scalp. If you are feeling there's breaking out, talk to your doctor, talk to the oncologist, and I'm sure they have something that they can recommend. If you happen to just lost some of the hair, but you still have many of your hair in your head, you still want to brush your head. Okay, do not be afraid to continue brushing your hair on a daily basis. You want to do it in the morning preferable, and you want to do it at nighttime before you go to bed. Again, that helps stimulate the scalp, and it helps your scalp to have luster, plus also the hair, untangle the hair. Do not stop brushing your hair. If you have to brush it and comb it and put it in a braid, or put it in use a cap at nighttime to sleep on, it's perfectly okay. But do not stop brushing your hair. You want to make sure that you brush on a daily basis, okay? You still want to brush your eyebrows and your eyelashes. Many times we forget about that, and a lot of times our patients ask me, my eyelashes are falling, my eyebrows are falling, what do I do? You still want to brush your eyebrows different directions, so you stimulate that area, because believe it or not, that area also has follicles, and as well as our eyelids. Okay, so that's something that is very important to do. And maybe you find a little brush like this and any local stores, makeup stores, that you can find them. It's important to care for your scalp. Again, be mindful of what feels comfortable to you, what smells comfortable to you. I personally, and I think many of the professionals out there, recommend to use essential oils, that's the number one questions I get all the time. What can I use after I have shaved my head to keep my scalp healthy? That if they feel comfortable, they can go ahead and use a little bit of essential oils. Make sure that essential oil that you're using, it's 100% essential oils. You do not want to use anything that has synthetics or any silicones on there. Whatever feels and smells comfortable to you, that you can not make you feel sick, you want to use in a very modern moderation, because essential oils, you can feel them right away. They stay in your hand for longer. So make sure that you put it in your head, you apply it, and you kind of massage yourself with that. Again, if you're doing it in the kitchen table and somebody's caring for you, allow them to put the essential oil on your head. I think that is the best gift that anybody can get. It's a great way to show love to somebody, and it's a great way to express how much they care for you, and how much they want to companion you and walk with you throughout your journey of hair restoration. Thank you again. I am so excited to share with you a little bit of my knowledge, but I want to call this video, tutorial video, whatever you want to call it, but I want to call it a self-care ritual. I think the ritual comes where we prepare the setting, we prepare the tools, we prepare the time, we make that time. whether it's 10 minutes, 20 minutes, a half an hour, or a whole day, that is up to you. I want you to experiment. I want you to not feel empowered that you can get things done on yourself, but also to make that time for yourself. You deserve to take care of yourself. You deserve to still feel loved. You still deserve to feel care, that you still feminine or masculine. You still have that power in you, that you can take care of yourself, or you can come to a professional and we'll be more than happy to assist you, to help you feel the best for you.